Good morning, students. So today we are going to see the fifth unit, that is family health nursing care, or you can say family health nursing. So family health nursing means care about the family members, and the family members include everyone, that is old, adult, children, pregnant women, and so on. So whoever is in the family is all about the care of the family members. Let's see the introduction. Family health care nursing is an art and a science that has evolved over the last 20 years as a way of thinking about and working with families. Family nursing comprises a philosophy and a way of interacting with clients that affects our nurses collect information, intervenes with patients, advocate for patients, and approach spiritual care with families. This philosophy and practice incorporates the assumption that health affects all members of family, that health and illnesses are family events, and that families influence the process and outcome of healthcare. So, if the one member in the family is sick, that means the whole family is getting affected. So the health care of each member of the family has a priority, and the family members also helps in getting the data related to patients. Whenever the patient is admitted in the hospital, if the patient is not able to answer the questions, so we means we nurses or doctor approach to the family members to know the basic details of the patients. Let's see the definition. Family health nursing is a nursing aspect of organized family healthcare services which are directed or focused on family as a unit care with health as the goal. It is thus synthesis of nursing care and healthcare. It helps to develop self-care abilities of the family and promote, protect and maintain its health. Family health nursing is generalized, well-balanced and integrated, comprehensive and continuous, are requiring comprehensive planning to accomplish its goal. The goal of the family health nursing include optimal functioning for the individual and for the family as a unit. So I have already told, family health nursing means you have to take care of the each member of the family, whether he is old, adult or a child. You have to take each member's care who is living in the family, and we always take family as one unit. One unit means the one you can say one area you're taking, and it is called as a family as a unit where you want to take the care of each member in the family. So the main goal of family health nursing is the health of the people living in the family. Then we'll see the objectives. The broad objectives of family health nursing are as under: to identify health and nursing needs and problems of each family. So first and foremost objective is to know the problems of the family members, those who are living. Then to ensure families' understanding and acceptance of those needs and problems. So then you have to analyze whether those disease conditions are accepted by the family members or not. You can see there are some places when the peoples are sick, so the family members does not treat them properly. So it is very necessary for each of the family members to attend those family members who are sick equally and give proper care. Then the next is to ensure families understanding next, to plan and provide health and nursing services with the active participation of family members. So if the person is sick, all family members should be actively participating in taking care of the family member. Then to help families develop abilities to deal with their health needs and health problems independently. So you have to teach that family member who is sick to deal with the situation to get well soon. Then we'll see the next, that is next objective, to contribute to families' performance of development functions and tastes. So while doing this care, health nursing care, you can make family to develop more in a positive direction. To keep family, make intelligent use of promotive, preventive, therapeutic and rehabilitative health and allied facilities and service in the community. So in order to help the family member, you should use all the possible ways that are provided by the government, so that he may be physically and mentally get cure from the disease. Then to educate, counsel and guide family members to cultivate good personal health habits, practice safe cultural practices and maintain wholesome physical, psychosocial and spiritual environment. So good education should be given to each of the family members so that they get physically, mentally and spiritually developed, which will help them to deal with the situations. Then next we'll see the principles. Provide service without discrimination. Provide service without discrimination means you should not categorize people according to caste, religion, race, then sex, then you can say according to their categories. You should not discriminate. All people should be treated equally. There is no poor and there is no rich in peoples. Then provide and periodic and continuous appraisal and evaluation of family health situation. So they should be continuous, have checkups to know the condition of the family. Then proper maintenance of record and reports. So all the records and reports should be properly maintained to know the events what has happened. Provide continuous services. Continuous service means continuous health services, that is continuous checkup. Health education, guidance and supervision as integral part of family health nursing. So this health education is a very important part of the family health nursing, so that you can provide and educate the person about the disease conditions that are harmful to them. Then maintain good IPR. IPR means interpersonal relationship. So a nurse should be good in maintaining IPR with the people so that they can know about their health conditions. Plan and provide family health nursing with active participation of family. So whenever you're planning for health education, you should try that all the family members should be there to listen your health education actively. Then service should be realistic in terms of resources available. So whatever services you're planning to give to the people, it should be real, not a fake one. Whatever articles are available, you should try to provide with the same articles. Encourage family to contribute towards community health. So you should encourage each family members to contribute to the community health. Community health means the area in which they are living. That is, they have to maintain their environment. So if their environment is clean, they are healthy. Then active participation is making healthcare delivery system. So whenever you are present in the community setting to give health education to the people, you should make sure that people are having active participation, which will help them to grow in a positive direction of the health. Then we'll see the advantages. What are the advantages of family health nursing? Family health nursing of patients save hospital beds that can be utilized for critical cases. So if the due to family health nursing, the people are having less chances to visit to hospitals, so their money is saved, and in the same time the hospital beds are kept empty for the emergency cases. Then family health nursing, it's cheaper than hospital nursing. So if you are giving health nursing to the family members properly, so you don't have to waste money in the hospital. Then patient and the family health nursing enjoys privacy and emotional support. So whatever environment you face in the hospital, if you are having good family health nursing, that is if you are taking care in the family only, then you no need to face those environments which is in the hospital. Patients on family health nursing can continue with the routine pursuit. So if you are in the home, you can go on your routine what you are following, but if you are in the hospital, you cannot follow what is your normal routine. If the patient resides in a sanitary house, family health nursing is better than hospital nursing, since he can control initial environment influences better. So if you are in the house, in your own family, so you get the environment what you want. But when you are in the hospital, you cannot go against the hospital rules and regulations. So it's better to have family health nursing where you can find your own comfort zone to get well faster. Then we'll see the disadvantage. Family health nursing requires the nurse to carry portable laboratory machines to the patient home. So there are certain disadvantages if the patients are sick and they take the hospital, you can say treatment from the hospital. So here the nurses faces problem because they have to carry all those heavy machines from the hospital to the patient's home. Then if the patient resides in the substandard house, family health nursing could delay his recovery. If the patient is not having proper home settings, he is not having proper environment, then it can delay the recovery of the patient because it will not help them to heal properly. Then we'll see the family-centered nursing approach. What are the works you can take in when they are in the family? The 4 approaches included in the family health nursing care views are the family as the context, family as the client, family as a system, family as a component of society. So when you are taking family health nursing, so what are the main approaches? That means what you should give more importance. So in this, the first one is family as the context. When the nurse views the family as context, the primary focus is on the health and development of the individual member existing within a specific environment. Although the nurse focuses the nursing process on the individual health status, the nurse also assesses the extent to which the family provides the individual basic needs. These needs vary depending on the individual's development level and situation. Because family provides more than just material essentials, their ability to help the client meet psychological needs must also be considered. Family members may need direct interventions themselves. So when the nurse takes family as a context, that means the nurse thinks that the family is the most important care provider at that time. So a nurse teaches all the family members how to take care of the patient, which help them to heal the patient faster and faster. Then family as a client. The family is the foreground and individuals are in the background. Family is seen as a sum of individuals, family members. The focus is to concentrate on each and every individual as they affect the whole family. So family as a client means whoever is living in the family is equally important, and so the care is given to all the family members so that the family will not be getting affected from other diseases. Then family as a system. Family as a system, you can say that if one gets affected, the other people also get affected. So it is very, very important to give equal opportunity to each family member so that they will be away from diseases what can affect their health. Then family as a component of society. So since family is a component of the society, so if they are getting sick, that means the other society members also get affected with those family members. So it is very, very essential that family should maintain their health and should also educate other peoples living in the society so that they can maintain their health properly. Then we see the elements of family nursing process. So these are certain elements of nursing process. We already know what are the 5 elements. So same elements we are going to use in this family nursing process. So the first one is assessment, then diagnosis, then planning and implementation and evaluation. So you already know that these are the common 5 nursing process, and same is the family nursing process. So first one is assessment of client problem. Assessment of client problem is to know about the client's condition, that is how he is feeling, from how many. That means you have to take the brief history of the patient in that assessment process, and you have to itself do the physical examination of the patient to know the reality of his condition. Then we can go for the next step, that is diagnosis. After the patient tells about his chief complaints history, after that it is very easy for the doctor to diagnose the condition of the patient. Then the third one is planning. So when you know what is the condition of the patient or what the patient is suffering from, so it is easy for the nurse to plan for the care of the patient, and then accordingly she plans and then put it into action. That is implementation. That is the fourth step, care of the patient. So in implementation, the nurse follows the doctor advice, and then she itself gives psychological support to the patient so that the patient can get healed properly. Then the last one is evaluation and documentation. So evaluation is the last step where we analyze the patient, whether the patient is recovered or not, and then we document whatever the patient is has taken the treatment from the day 1 to day last. So that is documentation process. Then we'll see the role of family nursing. Roles of family nursing means, you can say here, the role of nurse in family nursing. So here the word nurse plays the important role in family nursing. What is the nurse helping the patient? So the first one is health teacher. So here the nurse is a health teacher who is helping the family members to live their life in a healthy manner. Why? She can teach them how different diseases can affect their health, then how they have to consume their diet, how they have to maintain cleanliness. So this all teachings are given by the nurse, and so we call them a health teacher. The next is coordinator, collaborator and liaison. So here the nurse helps the family members to come together and deal with the problems that are affecting their family, affecting in their family. So with this, she is trying to collaborate or coordinate each of the family members to deal with the situation equally. The next is deliver and supervisor of care and technical expert. So being a nurse, she tries to deliver a proper nursing care to the patient and also supervise whether the patient is recovering or not, and then tries to take technical expert opinion, that is doctor's opinion, in order to help the patient in to get recover. Then family advocate. So she is the advocate of the family in a way, because she speaks on the basis of the patient. She tries to convey the message what patient wants, because she knows the each and every detail of the patient and tries to help him by becoming his advocate. Then consultant. Consultant means if the patient has any problem, so he can only ask to the nurse. So in that way, the nurse acts as a consultant by giving him advices. Then counselor. Counselor means trying to help the patient to recover psychologically, where the patient is feeling weak. She tries to maintain his health condition. Then case finder and epidemiologist. She tries to know about the condition of the patient and how the patient got affected with those disease, and tries to tell the patient about his situation, and then teaches him that how he has to get avoided with the situation to occur again. Then environmental modifier. She helps the patient to change his environment so that he cannot get into the situation again, so he will not fall ill again if he is changing the environmental if he modifies his environmental. Then clarifier and interpreter. She tries to clarify the doubt of the family members and tries to interpret with the difficulties what they are facing. Then surrogate. Surrogate, you can say she is helping the family members to stand in those difficult situation and trying to help them. You can say surrogate is a second mother when the mother is not able to take the child in his own womb. So in those cases also nurse is helping. Then researcher to know about the new disease conditions and to know the best treatment for that. And then role model for the other people, those who are seeing them as a caregiver. Then case manager is when they are dealing with the disease condition, that is the case manager. So these all are the role of the nurse, that is nurses doing in the hospital setting or in the case of the family health nursing. So today's class we have seen the family health nursing, we have seen the objectives, principles, then we have seen the family-centered nursing approach, and then we have seen the family nursing process, and we have seen the role of nurse. So that's all for the today's class. Thank you to all the students.